Introduction to Borderline Personality Disorder. Borderline personality disorder, BPD, is a mental health condition that was initially considered borderline between neurosis and psychosis, leading to the name. However, the term borderline may be misleading and stigmatizing, as it suggests a borderline state of insanity, which is not accurate. The current understanding of BPD is that it is a complex and distinct personality disorder. BPD is characterized by a pervasive pattern of instability in various areas of functioning, as defined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. Individuals with BPD often struggle with regulating emotions, maintaining stable relationships, and having a consistent self-image. Historically, BPD has been a subject of controversy and misunderstanding. In the mid-20th century, it was commonly misdiagnosed as schizophrenia or bipolar disorder. Only in the 1980s and 1990s, with advancements in psychiatric research and the introduction of DSM-3, did BPD gain recognition as a separate personality disorder. The prevalence of BPD is estimated to be around 1 to 2% in the general population, making it more common than previously believed. However, the actual prevalence may be higher, as some individuals with BPD may go undiagnosed due to stigma or difficulties in seeking help. BPD is diagnosed more frequently in clinical settings, where individuals seek mental health treatment. It is essential to recognize that BPD can affect people from all walks of life, regardless of age, gender, ethnicity, or socioeconomic background. To receive a diagnosis of borderline personality disorder, a person must meet specific criteria outlined in the DSM-5, which is a widely used manual for diagnosing mental disorders. A pervasive pattern of instability. Individuals with BPD experience a pervasive pattern of instability across different areas of their lives. This instability manifests in their relationships, self-image, emotions, and even their sense of identity. B. Unstable interpersonal relationships. People with BPD often struggle to maintain stable and healthy relationships. They may have intense and unpredictable emotions toward others, leading to frequent shifts between idealization and devaluation of those close to them. This can put significant strain on friendships, family bonds, and romantic partnerships. C. Unstable self-image. Individuals with BPD have a distorted or unclear sense of self. They may struggle with knowing who they truly are, what they want, or what their values are. This unstable self-identity can lead to difficulties in making decisions and forming a strong sense of direction in life. D. Emotional instability. Emotional dysregulation is a hallmark of BPD. Individuals with BPD experience emotions intensely and have difficulty managing them effectively. They may have frequent and extreme mood swings, going from feelings of happiness and euphoria to despair and anger within a short period. E. Impulsivity. People with BPD often engage in impulsive behaviors without thinking about the potential consequences. These impulsive acts can be risky and self-destructive, such as reckless driving, substance abuse, binge eating, or engaging in unsafe sexual practices. Differentiating BPD from other personality disorders. Borderline personality disorder shares some features with other personality disorders, making it necessary to distinguish it from similar conditions. Let's briefly discuss some common personality disorders and their distinguishing characteristics. A. Narcissistic personality disorder, NPD. Individuals with NPD often display an exaggerated sense of self-importance, a constant need for admiration. While people with BPD may also have difficulties with self-identity and relationships, their emotional instability and fear of abandonment are more prominent features. B. Histrionic personality disorder, HPD. HPD is characterized by a constant need for attention and being overly dramatic or theatrical. While people with BPD may exhibit some attention-seeking behaviors, their emotional volatility and fear of abandonment differentiate them from those with HPD. C. Avoidant personality disorder, AVPD. AVPD is marked by a fear of rejection, criticism, or disapproval, leading to social withdrawal and isolation. Individuals with BPD, on the other hand, may fear abandonment but may engage in more intense and tumultuous relationships. Individuals with borderline personality disorder often experience co-occurring mental health conditions, also known as comorbidities. Some of the common co-occurring disorders with BPD include A. Depression. Depression often co-occurs with BPD, and individuals may experience intense sadness, feelings of worthlessness, and a loss of interest in activities they once enjoyed. B. Anxiety disorders. BPD can be associated with various anxiety disorders, such as generalized anxiety disorder, panic disorder, or social anxiety disorder. These conditions can heighten emotional instability and fear of abandonment. C. Substance use. Some individuals with BPD may turn to substances like drugs or alcohol as a way to cope with their intense emotions and emptiness. Substance use can exacerbate the symptoms of BPD and hinder recovery. D. Eating disorders. BPD may also co-occur with eating disorders, such as bulimia or binge eating disorder. These eating disorders can be intertwined with emotional dysregulation and issues of self-image. How borderline personality disorder, BPD, affects relationships with others. Intense and unpredictable reactions. Individuals with BPD may react strongly to perceived slights, criticisms, or even minor changes in the relationship dynamics. Their emotional responses can be disproportionate to the situation, leading to intense arguments or emotional outbursts. Loved ones may feel like they are walking on eggshells to avoid triggering such reactions. Splitting. Splitting is a defense mechanism commonly seen in people with BPD. It refers to the tendency to view people, including themselves, as either all good or all bad, with no gray areas. As a result, someone with BPD may alternate between idealizing their partner and viewing them as the perfect source of love and happiness, and demonizing them as the cause of all their problems. This constant shifting in perception can be confusing and exhausting for the other person. Emotional manipulation. Due to their fear of abandonment and intense emotions, individuals with BPD may resort to emotional manipulation to maintain relationships. They might use threats of self-harm, suicide, or extreme emotional distress to elicit care and attention from their loved ones. While they may not be consciously manipulated, these behaviors can put immense strain on the relationship. Push-pull dynamics. People with BPD may engage in push-pull behaviors in relationships, wherein they alternate between pulling their partner close, seeking emotional intimacy and reassurance, and pushing them away, creating distance to protect themselves from potential rejection. This fluctuation can leave the other person feeling confused and unsure about the relationship's stability. Codependency. Codependency can develop in relationships with someone with BPD, as their emotional needs and intense fear of abandonment may lead the other person to prioritize their well-being over their own. This can lead to neglecting their own needs and boundaries, resulting in an imbalanced and unhealthy relationship. Difficulty trusting others. People with BPD may struggle with trusting others due to fears of betrayal or abandonment. This can result in a constant need for reassurance and difficulty forming deep, secure attachments. Splitting of self-identity. In addition to splitting perceptions of others, individuals with BPD may struggle with a fragmented sense of self. They may have difficulty understanding their own values, desires, and goals, leading to confusion about their identity and purpose in the relationship. High sensitivity to criticism. Criticism, even if constructive, can be hard for someone with BPD to handle. They may perceive criticism as rejection and respond with intense emotional reactions or defensive behaviors. Abandonment and fear of intimacy. Individuals with BPD may have an intense fear of being abandoned or rejected, leading them to avoid close relationships or become overly dependent on their partners. They may struggle with feelings of unworthiness and believe that their loved ones will eventually leave them, which can lead to constant reassurance seeking and clinginess. Unstable relationship patterns. The intense emotional fluctuations and fear of abandonment in BPD can result in unstable relationship patterns. People with BPD may cycle between intense feelings of love and devotion to feelings of anger and hostility, often triggered by perceived or real threats of rejection. Love-hate dynamics. Due to the splitting phenomenon, individuals with BPD may experience love-hate dynamics within relationships. They may alternate between expressing deep affection and admiration for their partner and feeling resentment or anger towards them. This emotional roller coaster can be overwhelming for both parties involved. Difficulty communicating needs and boundaries. Individuals with BPD may struggle to communicate their needs effectively or understand the boundaries of others. Their intense emotions and fears may overshadow their ability to engage in healthy communication, leading to misunderstandings and conflicts in the relationship. Self-destructive behaviors impacting relationships. BPD can be associated with self-destructive behaviors, such as self-harm or suicidal tendencies. When these behaviors occur in the context of a relationship, they can create immense stress and concern for the partner, who may feel helpless and unsure of how to provide support. Relationship idealization. At times, individuals with BPD may idealize their partners, seeing them as the perfect solution to all their emotional needs. This idealization can put immense pressure on the partner to fulfill unrealistic expectations, leading to disappointment and potential conflict when the partner inevitably falls short of these expectations. Isolation and social withdrawal. The challenges presented by BPD in maintaining stable relationships may lead individuals to isolate themselves from others. They might avoid social interactions to protect themselves from potential rejection or abandonment, further exacerbating feelings of loneliness and disconnection. Impact on family and friendships. BPD can also affect relationships with family members and friends. Loved ones may find it challenging to understand and cope with the emotional intensity and unpredictability of their family member or friend with BPD. They may feel overwhelmed or emotionally drained, impacting their own well-being. Caregiver and support network strain. BPD can put significant strain on caregivers, family members, and close friends who provide support to the individual with the disorder. Constant emotional turmoil, impulsive behaviors, and self-destructive tendencies may lead to feelings of helplessness and burnout among those trying to offer support. Roller coaster of intimacy and distance. In relationships with individuals with BPD, there may be a constant cycle of intense emotional intimacy followed by sudden distancing or detachment. This push-pull dynamic can create confusion and emotional exhaustion for both partners. Repeated breakups and reconciliations. Due to the emotional volatility and fear of abandonment, relationships with someone with BPD may experience frequent breakups and reconciliations. The individual may push their partner away during moments of distress but later seek to reunite when feeling emotionally vulnerable. Externalizing and blaming. People with BPD may externalize their emotions, projecting their internal struggles onto their partners or loved ones. They might blame others for their emotional distress, leading to strained and conflict-ridden relationships. Identity fusion. Individuals with BPD may have a tendency to lose themselves in their relationships, known as identity fusion. They may struggle to differentiate their own needs and desires from those of their partner, leading to an enmeshed and unhealthy relationship dynamic. Rejection sensitivity. People with BPD may have an extreme sensitivity to rejection, leading them to perceive even minor instances of criticism or disagreement as abandonment. This hypersensitivity can lead to frequent conflicts in relationships. Feelings of guilt and shame. Individuals with BPD may struggle with feelings of guilt and shame related to their impulsive actions and emotional reactions. This emotional burden can lead to self-isolation and further difficulties in forming and maintaining relationships. Impact on friendships.